Hello everyone, welcome, and thank you for joining us. My name is Lena, and I am one of the mental health consultants with Louisiana's Provider to Provider Consultation Line, better known as PPCL. Before I introduce you to Dr. Waldman, I'd like to tell you a little bit about PPCL. PPCL is a no-cost consultation and education program that aims to help pediatric and perinatal healthcare providers address their patients' behavioral and mental health needs. PPCL's goal is to build capacity to identify, diagnose, treat, and refer patients with mental health concerns. Consultation includes guidance on screening, diagnosis, treatment, and medication management. This guidance can be for a specific patient or general in nature. We also have a resource specialist available to provide real-time support to providers who are wanting to connect patients to mental health and other community supports. Lastly, we provide education and training to providers in order to build their confidence in addressing mental health issues. Not only does our program offer a variety of trainings, but we also give providers access to clinical materials and information via our website. When a provider has a question, they can call PPCL at 833-721-2881 and speak directly with someone during our regular business hours. Or they can visit our website at ldh.la.gov/PPCL to submit a consult request. One of our licensed mental health professionals will triage the call and respond to questions within the scope of their practice. If the question requires a psychiatrist, then arrangements will be made to connect the provider to the psychiatrist. The expertise of our mental health consultation team runs deep. Our psychiatry team includes Dr. Juliana Finelli and Dr. Megan Vincent, who specialize in perinatal mental health. It is my pleasure to introduce you to Dr. Daniel Waldman. Dr. Waldman works directly with PPCL as our child and adolescent psychiatrist. Stay tuned at the end of this video for more information about PPCL. Again, thank you for joining us, and I'll pass it to Dr. Waldman.
Hi everyone, my name is Daniel Waldman. I'm a child psychiatrist, and today we're going to be talking about some tools that I think are particularly helpful for both kind of like suicide risk assessment and management in various clinical settings. So let's go ahead and get started. Okay, so first I want to talk to you guys briefly about conducting risk assessments using NIMH's ASQ. I think that this is a really helpful tool that if you don't have something set up in your clinical space yet, I would encourage you to consider using this as a resource to do that. Next, we're going to review safety planning and what that looks like for youth. And finally, thinking about things you can set up and put in place in your clinics that will support crisis management when it comes up, because chances are these things will come up. So ASQ is just ask suicide screening questions, and this is a rapid psychometrically sound 4-item screening tool for all pediatric and adult patients presenting to the emergency department, inpatient units like medical units, and primary care facilities. And I really like this. I think that as opposed to, I think that I've worked in clinical spaces that have used the Columbia Suicide Severity Rating Questionnaire, which I think is also really helpful. And I wouldn't suggest if your practice is using another tool like the Columbia scale and that is working effectively, I wouldn't suggest necessarily changing. But if you're going to start with something new, I think that this is a really nice tool. One, it was designed with the thought that we need a tool that works for kids and adults. And there's some variations for the youth model versus the adult model, which allows us to kind of use this more broadly. It also has specific supporting protocols and resources for each of these settings. So whether you work in an emergency department, in a medical inpatient unit, or in a primary care space, or even on telehealth. They have specific resources that'll help guide suicide screening and management in each of these spaces. Here are the 4 questions that you ask, and I think I just wanted to share them. In the past few weeks, have you wished you were dead? In the past few weeks, have you felt that you or your family would be better off if you were dead? In the past week, have you been having thoughts about killing yourself? Number 4, have you ever tried to kill yourself? If the patient answers yes to any of the above, ask the following acuity question. Are you having thoughts of killing yourself right now? And then it walks you through an algorithm for determining next steps, and also lists at the bottom the resources to all patients, which they have not yet updated to reflect our nationalized 988 number, which you can see in my background, but has the crisis text line as well as the suicide prevention lifeline. As I said, there's clinical pathways for the ED, both youth and adult, inpatient, both youth and adult, outpatient, youth and adult, as well as COVID-19 telehealth, youth and adult. The next thing I want to talk to you guys about is safety planning. I think that this is such a critical component of mitigating suicide risk, as well as something that I use frequently as an assessment tool. And I've grown to really appreciate the process of safety planning with patients as a way to better understand what's going on with them beyond the initial screening. Safety planning is usually composed of these core elements. First, you want to identify for the patient what their warning signs are that might be leading to these thoughts. What are coping strategies they are aware of? What are coping strategies they're actively using? What are coping strategies they want to be able to use that can help them deal with really intense, intrusive thoughts? What are people in situations that provide distraction? What are people that they can ask for help? Who is their professional support? And what emergency resources do they have? Finally, with the whole family, we really need to discuss environmental safety and help them brainstorm like what are the reasons to live. This is the Brown-Stanley Patient Safety Plan template. I think that this is really helpful. I've seen a lot of clinicians kind of create their own specific to their community resources or specific to their patient population. But I think that it's perfectly okay to just use this patient safety plan template, and it lets people kind of step by step develop their own safety plan. There's no right way to do this. You have to kind of assess the motivation and development of the person sitting in front of you. Sometimes this is something that they can do independently, and then you can kind of go over it with them. Sometimes this is something that will need to be done more collaboratively, where maybe you do the writing and ask them each question individually and help coach them through some of the answers. But either way, I think it's going to give you a lot of insight into how serious these thoughts are for patients that really struggle with this. It does raise a concern for me often about the safety and discharge planning, because I think that this is the ability to engage in thoughtful, meaningful conversation around safety planning is a really critical part of patient safety and making sure that they are safe to go home and be managed on an outpatient basis. The last thing I want to talk to you guys about is policies and procedures for crisis management. So like I have been in all sorts of clinics, often like primary care settings, sometimes like strictly psychiatric settings, in the ER where, crises have come up in my clinic. And I can tell you things go so much better, both for the clinician, but also really the patient and their family. If we have good plans in place, this is like a really, really stressful time for patients. And if we have a plan for how to handle it, this whole experience can be a less stressful process for them. The first thing is to just have the documents you need at your disposal. So if you are in a place where like a PE scene is going to come up, you need to make sure those forms are readily available. So that doesn't have to be an arduous process, just getting the forms. The next thing is within the clinic, just make sure everyone kind of knows their role. So if you need to ask someone to do something, so this really usually requires more than that one clinician to manage a crisis. There's different responsibilities like contacting transportation, contacting authorities, contacting family members, supervising patients, moving people from, like if there's a clinical space that we still need to use to see other patients, moving them to another place and then making sure they're supervised there. So all these things, it's helpful to kind of have an idea of who might be available to participate and help with this if it does come up. Designated space for maintaining patient safety. Part of this is, their safety. Part of this too is their privacy. And part of it too is making sure it's like a calm, supportive space that hopefully is least stressful as possible. Again, this is really, really hard in busy clinical settings, but I think recognizing that this is an important part of what your function is as a clinic is to be able to provide this service for people, is making sure there's some buffer to allow that, like, if a crisis does come up, people can shift roles and participate in helping support that situation, even at the expense of doing some of their other tasks. Knowing your local ER and crisis support teams, just how to get in touch with them, having liaisons and relationships with them can help this process go more smoothly, and it's really reassuring for patients and families. Thanks so much for paying attention to this. I think these things will really help both assess and manage crises related to suicidality in various clinical settings. And if you put a little time into preparing for this, it'll go a long way. Thanks.
Want to know more about PPCL? Call us at 833-721-2881 or visit our website at ldh.la.gov/PPCL. You can also scan the QR code to register for our program. Registration takes about 1 to 2 minutes to complete. Thanks again for joining us, and we hope you have a great day.